All right, sisters and brothers, welcome to another Worker Power Hour. My name's Dave Schneider. I'm a union steward. I'm also a package driver at UPS in Jacksonville, Florida, at a local 512. Reason I'm recording this video today is the COVID-19 pandemic that swept the United States and the world right now. Last time I checked, we were just over about 187,000 confirmed cases, about, a little over 3,800 deaths. This is as of March 31st, 2020. This is obviously only going to go up from here. And I think as more people have tuned in and started taking it very seriously, what's going on with COVID-19, I think it's particularly important for those of us who are in so-called essential critical infrastructure, as all UPS Teamsters are, to really look out for ourselves, look out for our family, and look out for each other's health. Our brother, William Young, a Teamster out of Chicago, out of local 710, is, to my knowledge, the first UPS Teamster to die of COVID-19. He passed away yesterday. He's a 15-year feeder driver out of the Cache facility in Chicago, one of the biggest UPS hubs in the country. I don't know what to say. He's succeeded by his wife, Rita. He has his family there, all of his coworkers at UPS Cache. From the bottom of my heart, I wish you all very, very sincere condolences. And I will say this, part of the reason I want to record this video is that learning about William's death, I think should be a wake-up call for every UPS Teamster in the United States, that we need to take this virus very seriously. I know a lot of us already are. Unfortunately, this company seems to be still very much more concerned about making profits than they are about the safety of us who go out and actually make those profits with our labor. And so I'm going to break this video into two parts. The first part, I want to talk about the sick leave program that the IBT, the International Brotherhood of Teamsters, and UPS management worked out about 2 weeks ago. I want to talk about that, go over how people can use it, get some of the more technical side of this stuff, so that people kind of know what options are available to them if they start feeling sick, or if they have a family member who's sick. We're going to talk about that. I also want to talk about, in this video, some of the workers that are going to be more at risk of COVID-19. Now, obviously, there's a new virus. There's new studies coming out literally every day. I mean, there's 20, 30, 40 of these things coming out every day. So we don't know everything. But based off what we know, we can draw some conclusions about who, needs to take some extra precautions. And then, we're going to talk also about just kind of in general, how you can sort of take this more seriously and act if you start coming down with any of the symptoms. In the second video that I think I'm going to release separately, I'm going to talk a little bit about some of our demands. Getting sick leave, which we're about to talk about, it's a start, but it is nowhere near enough. And if you're like me, whether you're a package driver or whether you just work in the facility, and I know that in most locations in the United States, UPS management is still very much not taking this very seriously. Certainly not seriously in a way that's actually going to meaningfully protect us. It seems like they're more concerned about protecting their profits right now. So we're going to talk about that in the second video, what some of our demands ought to be and maybe how we go about fighting for some of them. So I do want to jump in, though, on sick leave and explain that to people. I know a lot of members in Jacksonville, including some people that I represent, have asked me about how do you use this. I will say UPS's communication on their plan, if such a plan exists, has been incredibly poor to date. I don't think anybody can really question that. I know that the vast majority of part-time workers in Jacksonville still do not know even that this sick leave program exists. And, in the following video, we're going to talk a little bit about why that's the case, but I'm recording it so that way people know what they can use. So let's jump right into it. 2 weeks ago, UPS and the IBT came out and they agreed to an emergency COVID-19 related sick leave policy. Basically, here's how it goes. If you get COVID-19, you get up to 10 paid days of sick leave. For full-timers, that means you're going to get 8 hours a day, for up to 10 days. So effectively, that's 2 weeks, right? Because, you're not counting your weekend days, of course. Effectively, that's 2 weeks of sick leave. 8 hours for full-timers, 3.5 hours for part-timers. That's just how it goes as far as the agreed upon sick leave policy at the national level. In order to qualify for the 10 paid days of sick leave, you have to either be diagnosed with COVID-19, you have to be quarantined by a government agency, a medical professional, or UPS, or, and I say or, not and, you're living with somebody who has been diagnosed with COVID-19. That could be a family member, it could be a roommate. Point is, if you're living with somebody who's been diagnosed also, you can also use the 10 paid days of sick leave. If you end up getting to the end of the 10 paid days of sick leave and you need more time, you can use your option days, you can use your vacation days, and just to say, Family Medical Leave Act, at least, to my knowledge, in the vast majority of the states in the U.S., I imagine you could probably use that too, but you should contact your local union and figure out how you might be able to use that if you end up needing more time to recover. However, if you need more time to recover, whether you get on FMLA or not, UPS and the Teamsters have agreed there is going to be no discipline on UPS employees for COVID-19 related absenteeism. So basically that means if you need more sick leave, frankly, you don't even need to get on FMLA. I mean, there's not going to be any discipline related to staying out because of COVID-19. I would say, and I don't know this across the board, so I don't want to speak on it, but I'll say this: if you're feeling sick, and even if it's not necessarily COVID-19 symptoms or you just don't know, I would contact your supervisor. I would let the union hall know. And if you call out and then, the next day or 2 days from then, you realize, it was food poisoning or something like that, I can't imagine you're going to get written up for that at this time. And, obviously, if you do, you need to have a union steward there with you as always. But basically, they've agreed there's not going to be any COVID-19 absence-related discipline. So let's talk for a second about how would you know if you had COVID-19? Well, the trick is a lot of us very well might not, because it seems that in a lot of these cases, if not a majority, the patient is asymptomatic, meaning that they're not showing any symptoms at all. Sometimes they're asymptomatic for the duration of the illness. Sometimes they're asymptomatic for a little bit during an incubation period, and then they start showing symptoms. However, it is important to know what the symptoms are, so if you come down with any of them, you can contact a medical professional or a doctor right away. The 3 symptoms that seem to be common to practically every symptomatic case of COVID-19 that's been recorded is that you will have one or more of the following: a fever, a cough, and usually I've heard this described as a dry cough. So not so much like a lot of phlegm or like, something that might be related to allergies. Although, if it's any kind of cough, you should probably contact a medical professional to be on the safe side. And then the third one is trouble breathing. I've heard people describing that they feel like a burning sensation in their chest. I've heard people just describe that, they're a little short of breath. You can read all sorts of accounts, but if you have any of those, any one or multiple, please make sure to call a doctor or a medical professional immediately and make sure you go in to get tested. Okay, so let's talk for a second about how would you go get tested. Well, you could go into a doctor. I know that a lot of hospitals are getting filled up right now. I don't think we're at maximum capacity, but you can believe we probably will be here before very much longer. I would say there are in most U.S. cities, at least that I've found, even here in Florida, where frankly our state's response has been pitiful, we now have drive-up testing, and a lot of them are low to no cost, at least to my knowledge. And, at least for us, our insurance is going to cover the bulk of COVID-19 testing, at least as far as I've read from TeamCare. So, I would say if you have drive-up testing in your area, I would go take advantage of it if you have any of these 3 symptoms. Bring your insurance card as usual, but, go get tested. There's also another option available to Teamsters. If you're on TeamCare, you can use what's called TellaDoc. Now, I've never used this before. I just found out about this recently. But this, frankly, seems like a really important program for us to take note of. That's TellaDoc, TellaDoc. Okay, it's an online healthcare service where basically over a computer or a phone, you Skype, and I think you can talk to a medical professional, and, describe your symptoms. And they'll be able to kind of tell you what to do next, especially if you're talking about, trying to be able to use this sick leave because you think you're sick or you think another person in your household is sick. I would really look at that as a possibility, as a possible option. And that is free for Teamsters on TeamCare. So please keep that in mind. TellaDoc is a great option. Okay, just to say, some of our workers, some people just in general, but some of the UPS Teamsters are going to be a little bit more at risk according to the CDC than others. The characteristics they've found of people who might be more at risk for contracting COVID-19 and having serious complications are the following. If you're over the age of 65 years old, if you are immunocompromised for whatever reason, if you have asthma, mild to severe, or chronic lung disease, if you have heart disease, if you have severe obesity, if you're pregnant, or if you have other conditions like diabetes, renal failure, liver failure, that kind of thing, if you have anything that I just described there, or any other existing conditions that you think, might put you at more risk, please talk to a doctor as soon as possible. Let them know, look, I work at UPS. This is what my workday looks like. I work around this many people, or I deliver to this facility or that facility, or what have you. Let them know the full scope of the risk, because if you fall into any of these categories, your medical professional, your doctor, whoever you end up talking to might say, yep, we need to get you on sick leave immediately, and and that would qualify you then for the 10 paid days of sick leave that UPS and the Teamsters have reached. I would really encourage people to get on that as soon as possible, because this situation is obviously just getting more dire. I'll say this just to kind of cap off this video. 10 days of paid sick leave, like I said, great start, certainly not enough. There are COVID-19 patients that can be contagious for up to a month, I've read in certain accounts by different doctors. And I'm not talking about, some other countries either. I'm saying they've recorded cases like that right here in the United States. More importantly, as the case count grows and grows, we don't really know if it's one of those things you get it once and then you're good. Your body's built up a vaccine to it. We just simply don't know. And the reality is some of us could get sick and then get sick again. Or some of us could get sick and we might be out of work for, a fairly lengthy amount of time. I would say, use the program as we have it, but we need to continue fighting for more. Our Teamster union leaders need to continue fighting for more. We're going to talk a little bit about those demands and more in the next video. I would just encourage you all, please be safe out there. Please take care of yourselves, take care of your coworkers, take care of your family, okay? Because you only get one life to live. And the reality is, we're the reason that this company is able to make profits and whatnot, but ultimately they're not going to be looking out for you. We have to look out for each other. So thank you for watching, and please check out the next video, Union Power.